Hello, welcome to my YouTube channel. It's Sister Annabelle Ines from Zambia. If you're a returning subscriber, I say thank you so much for returning to my channel. And if you're a new subscriber, I say thank you so much for subscribing to this channel. Hope you're going to like the information you're going to get from this channel. Today, we have a very good topic and the entire world is talking about it. We are going to discuss about coronavirus. We are going to talk about COVID-19, what it does to our body for us to start developing difficulty in breathing. So I want you to stay tuned. Drop the comments if you're enjoying the presentation. Don't forget to subscribe if you're new, and don't forget to like it. So we are going to begin. Like I always say, when you're defining a condition, don't forget to include the causative organism and the signs and symptoms of that condition. So I'm going to define coronavirus according to my own understanding and include those two cardinal points. So I'll read through first, then we'll discuss. So coronavirus, the definition. Coronavirus is an infectious respiratory disease caused by a virus called SARS-CoV-2, characterized by chest pain, difficulty in breathing, fever, chills, coughing, headache, fatigue, and muscle pain. Coronavirus is an infectious respiratory disease caused by a virus called SARS-CoV-2, characterized by chest pain, difficulty in breathing, fever, chills, coughing, headache, fatigue, and muscle pain. That is the definition. If you write that in an exam, I can assure you 5 marks is yours. The causative organism is SARS-CoV-2. SARS-CoV-2. It belongs to the coronavirus family. So SARS-CoV-2 is the one that causes COVID-19. Mode of transmission is through air droplets. So through coughing, sneezing, talking, I can assure you, you can get COVID-19 through those things. Or when you touch on the surface where somebody coughed and then you touch and then you touch your mouth or your nose, you can get COVID-19. The pathophysiology of COVID-19, I want you to get a pen and a paper, jot down some points. In case it came in an exam, it will be easy for you to remember because I've summarized it in a way that will be easy for especially students to remember. So I'm going to read through first the pathophysiology and then I will explain after I read through. So following inhalation of droplets containing SARS-CoV-2, the virus enters the body and reaches the lungs. This virus affects the living cells of your body for it to replicate or reproduce. Inside the virus contains several genetic materials to make copies of itself. It has a protein shell that protects the genetic materials as it travels within the people it infects. The outer envelope of the virus contains the protein molecules that allows the virus to infect a cell by imaging with a cell inside the body, where it takes over the cell internal machine for it to reproduce the new viruses. When the person infected coughs, talks, or sneezes, the droplets carrying the virus enters through the nose or the mouth, moves to the lungs inside the body, where the virus comes in contact with the cells of the throat, nose, and the lungs. This virus inserts its protein molecules to the receptors molecules of the health cell membrane of the body. So it attaches there like a key and the lock. So this action of attachment of a key and a lock, this attachment allows the virus to get inside the cell. A typical flu virus will travel inside the sac made from the cell membrane of your cell nucleus to your cell nucleus. On the other hand, the virus does not need to enter the nucleus for it to enter the nucleus of the host for it to access the nucleus and start replicating. But what it does, it will copy the ribosomes, it will access the ribosomes, which uses the genetic information from the virus to make several viral proteins and spikes of the virus on its surface. This structure contains all components or all parts of the virus that the virus needs to create itself. So this component, this new virus begins to burst out from the cell membrane. With a new virus, they begin to burst out from the cell membrane after it has gathered all the components that it needs for it to create itself. So when the virus is spreading to your body, the body will try to fight infection. In the alveolar, where the gaseous exchange takes place, inflammatory process will occur, which will lead to the swelling of the alveolar and accumulation of fluids in the alveolar, where the gaseous exchange takes place. So the swelling of the alveolar will lead to chest pains, and then the accumulation of fluids in the alveolar can cause pneumonia, which can be lobe pneumonia or bronchopneumonia, leading to other signs and symptoms of coronavirus. So if the virus worsens in the body, or the virus keep on multiplying and the condition worsens, the patient can go into a complication called respiratory failure. So that's about the pathophysiology. I will explain a bit. So it's saying when you inhale the droplets that contains SARS-CoV-2, the virus meets the other cells of the throat, cells in the trachea, in the bronchi, in the bronchioles, all these cells where the virus is passing through. It attaches. It has receptors. Yes, protein molecules that attaches to your receptors. So what it does when it attaches itself into the receptors, it infuses into the cell. In the cell, it just needs the information from the ribosomes, and then it will replicate itself. So it really doesn't need to enter the nucleus of your cell. So the body will sense to say that we have an infection, and the body will try to fight this virus. So inflammatory process is going to occur. You know, the inflammation, the redness, the swelling. So it will occur where the body is fighting the infection, which is the alveolar. Now we know that in the alveolar, that's where the gaseous exchange happens. That's where the body takes up the oxygen and releases the carbon dioxide. So when this alveolar is inflamed, if it is inflamed, it will fail to expand and relax. That process will be limited or will be altered because of the inflammation. So the body will be taking less oxygen, less or zero oxygen, and releasing zero carbon dioxide, which will lead to difficulty in breathing. So the swelling, the swelling and the accumulation of fluid as your body tries to fight infection can lead to pneumonia. So pneumonia can start from the lobe pneumonia to the whole chest, the all lobes, the both lobes to have pneumonia, and then it can be pneumonia like that. So literally that's what happens when you have COVID-19. So having said the the pathophysiology of COVID-19. We're going to talk about the signs and symptoms, which will say there will be chest pain due to inflammatory process in the chest. So there will be chest pain due to inflammation. Then there will be headache due to hypoxia. There will be fever and chills. There will be also cough. There will be muscle pain, fatigue or feeling tired easily. Then there will be difficulty in breathing. So having said the signs and symptoms, what are the predisposing factors? So the predisposing factor can be age. So elderly people, because of low immunity, they are prone to HIV/AIDS, and then those people with other underlying diseases, like those people who have HIV, diabetes, hypertension, renal failure. So those people who have other conditions that suppresses the immune system, they are also prone to have COVID-19. So having said the predisposing factors, and then what is the treatment? So there are a lot of treatments going around the world, but when you come to the hospital, as here in Zambia, how we are treating people with coronavirus is when you come with mild symptoms, like you just have fever, you have a cough, where you have a fatigue. So corona has no cure yet, but we are going to treat the clinical presentation of the patient. So we are treating the signs and symptoms that you are coming with. So if you come with a cough, we will give you medication for cough so that cough goes. If you come with fever, we are going to reduce that fever, that temperature, so that you are fine. So we have drugs that we are giving. We are giving azithromycin. Azithromycin is a broad spectrum antibiotic, and azithromycin treats cough, it treats chest pains. It treats chest pains, it treats sore throat, yes, infections, and then it also treats the nose infection, any nose infection, sore throat, and the chest infections. Azithromycin treats that. That's why we're giving azithromycin. And then we're also giving vitamin C. Now you know how vitamin C works in the body. Vitamin C has a lot of functions, and it helps the body very much. So one of the functions of vitamin C, it helps in wound healing, it helps in proper repairing of damaged tissues, it helps in normal functioning of the proper functioning of the immune system. So we are also giving vitamin C for those repairing of damaged tissues and proper functioning of the immune system. Then if you come with fever, chills, and then we are also giving paracetamol, which is Panadol. We are giving paracetamol to reduce the fever and to manage the pain. Then we are encouraging these patients who've come with mild signs and symptoms to take enough rest and then to isolate themselves at home. Yes, but if you come in an advanced stage of COVID-19 where you're having difficulties in breathing and your oxygen saturation in the body is less than 93, we are putting you to we are giving you oxygen therapy. So we'll give you oxygen if you're having difficulty in breathing and you're saturating less than 93%. But in a case where it's complicated, you have respiratory failure, then we are putting you on a ventilator to help you breathe. So that's the medical treatment that we're using at the hospital. Prevention of COVID-19. How you can prevent COVID-19? Please, number one, mask up. Wear a mask. Each time you move out of your home, wear a mask. Wash hands frequently and thorough wash of hands. Wash hands at least 20 minutes. Wash them nicely. Don't keep long nails, so wash hands nicely. And then social distance, where if you're in a public place, please observe social distance, at least 1 meter apart. Avoid avoid cloud places where there are a lot of people. Please avoid. If it's not important to you, the main reason of that gathering, please don't go there. Stay home. Stay home. If you can, stay home. You only move out when you have important things to do away from your place. So that's about coronavirus. But what if you have these signs and symptoms and you are at home? So if you intend to have some signs and symptoms of coronavirus and you are at home, first thing you should do, isolate yourself. You isolate yourself at least for a week. Yes, if you can't isolate yourself due to the house where you're staying, maybe there are no spare rooms where you can isolate yourself, wear a mask. If possible, wear a mask even at home. Wear a mask. So there are a lot of home remedies that you can do to treat your signs and symptoms. So if you have sore throat, you can take lemons, honey, you can do ginger, and then you just boil them, you add honey, and then you drink. Or you can do lemon soda and water. You can boil those things and drink. Then you can do steaming, although it's not scientifically proven yet. You can do steaming, but be aware of burns, because we don't want you, we are preventing you from coronavirus, and then you come back with burns. So be aware of burns, please, especially to children. When you're steaming, be aware of burns. If it's working to you, please, you can do steaming, but be aware of burns. If you were in contact with somebody who has some signs and symptoms of COVID-19 from your workplaces, please, as you come home, try to wear a mask to prevent other family members from getting COVID-19. So having said all those about COVID-19, I hope you've gotten something. I hope you've gotten something. So it's your sister Annie Bell. Please hope you've enjoyed this presentation. Don't forget to invite others. Don't forget to tell them to subscribe. Tell them to subscribe. Tell them to like it. I need the likes. And tell them to drop the comment. If you need any clarification, or if you need any question to be answered. From me to you, it's God bless and bye-bye.